Okay, Doc, we could start.
Good morning, everyone. I am deeply honored to be invited as one of your speakers today. I will be talking about strengthening immunity through healthy lifestyle. Marts, dali lagi Marts. Wala siya Marts gano. Marts, liwat. Wala siya gaklikaw. Marts, Marts. Marts.
Sige, Doc. Okay na, Doc. Dila ka lang start, Doc.
Sige. 1, 2, 3, go. Good morning, everyone. I am deeply honored to be invited as one of your speakers. Today, I will be talking about strengthening immunity through healthy lifestyle. For my objectives, we will identify the factors that can boost as well as those that can weaken our immune system in relation to food, exercise, sleep, stress, and COVID-19. We will discuss further about nutritional, exercise, sleep, and stress in relation to immunity. And lastly, we will identify ways to incorporate a healthy lifestyle in our busy lives. Our immune system is designed to fight against and destroy foreign entities like bacteria and viruses, which prevents us from getting sick. Multiple factors like stress, age, body composition, or our lifestyle can affect the performance of our immune system. Our immune system's capacity declines as we get older due to decrease in functioning of T cells. Too much or too little body fat can lead to suppression of the immune system. Excess weight gain can put you at the risk of developing comorbid conditions, thus decreasing the body's ability to fight against infections due to a weak immune response. A healthy diet and regular physical activity also supports the immune system by increasing the number of fighter cells in the body. Adequate amounts of rest every day can minimize the stress levels, which can in turn affect our immunity. A healthy gut bacteria in the intestine work integrally with our immune system. Your first line of defense is to choose a healthy lifestyle. Adequate and appropriate nutrition is required for all cells to function optimally, most especially cells in the immune system. This journal describes the influence of nutrition on immunologic outcomes. It highlights the important role of macronutrients, micronutrients, and probiotics and other minerals in modulating immune response, because nutrients exert their role in innate immunity and inflammation, as well as regulation of adaptive immune response. Examples of nutrients that have been identified as critical for the growth and function of immune cells include vitamin C, vitamin D, zinc, selenium, iron, and protein, which is found in a variety of plant and animal foods. Adequate amounts are essential because they play a vital role at every stage of the immune response to ensure the proper function of physical barriers and immune cells. So first, we will discuss the micronutrient vitamin C and its relation on immunity. This paper is about the role of vitamin C in phagocyte function, wherein vitamin C has been shown to enhance neutrophil migration, enhance engulfment or phagocytosis of microbes, generation and killing of microbe, apoptosis, clearance by macrophages, and inhibits necrosis, thus supporting resolution of the inflammatory response and attenuating tissue damage. Excellent levels of vitamin C are found in numerous fruits and vegetables. The high vitamin C content in citrus fruits helps increase the production of white blood cells, which are key to fighting infections. And examples are citrus fruits include oranges, grapes, and kiwi. Greatest dietary antioxidant properties can be found in foods rich in vitamin C, also known as ascorbic acid. An antioxidant is a substance that inhibits oxidation or removes potentially damaging oxidizing agents or free radicals, which comes from processed foods, smoking, alcohol, stress, and UV exposures. Vitamin C can actually be found in so many foods that most people may not need to take overdosage of supplements, like for example, 7 orange fruits such as oranges, kiwi, strawberries, or 8 cups of orange juice already contains 500 milligrams of vitamin C. In this journal, it presents the possible implementation of high-dose vitamin C in the prevention and therapy of coronavirus. In this paper, There were studies that have shown that a high percentage of critically ill patients are deficient in vitamin C, wherein it was found out that 75% of the patients had plasma levels of vitamin C that were abnormally low. Ongoing clinical trials investigating the effects of vitamin C in COVID-19 are studying the effects of ascorbic acid as prophylaxis, which can be effective for primary prevention of viral infections. Although further investigation should be done in these trials, this may provide timely data on the possible preventive and therapeutic values of vitamin C for medical and public interest in the current COVID-19 pandemic. Effects of vitamin D on monocytes and macrophages are recognized. Adequate intake of vitamin D helps maintain and strengthen the body's defense against infection by promoting the innate immunity. The recommended dose for vitamin D is 880 milligrams and can be found in the food that we eat, such as a serving of salmon, which contains 526 IU of vitamin D. Egg yolks, certain cereals, and instant oatmeals are also fortified with vitamin D. Sunlight is a must for the synthesis of vitamin D in our body. Just 10 to 15 minutes of sunlight exposure can provide 3,000 to 20,000 IU. There are a lot of health benefits of sunlight, and one of those is how it boosts our immunity. When our skin gets exposed to sunlight for an adequate duration, the blue light spectrum of the sun helps our white blood cells to circulate in the body more effectively to help fight infections. It also improves our mood by increasing serotonin, a hormone associated with improving our mood. Vitamin E is also an important antioxidant. It plays a vital role in stopping free radical production and helps maintain with the regulation of cellular immunity and protection against infection. The major dietary sources of vitamin E are vegetable oils. Nuts, soybean, sunflower corn, walnuts oils contain also relatively higher amounts of vitamin E as well. This is a journal about vitamin E being a potent lipid-soluble antioxidant. Vitamin E has been shown to protect the polyunsaturated fatty acids in the membrane from oxidation and enhance immune response by its immunomodulatory mechanisms against several infections and diseases. Zinc is an essential trace mineral that is required for the growth and development of immune cells involved in both innate and acquired immunity and important for the synthesis of antibodies. Zinc affects gene regulation with lymphocytes and is crucial for normal development and function of cells, mediating nonspecific immunity, such as neutrophils and growth and function of T and B cells. A plant-based diet could meet up the needed zinc requirements in our diet. Foods rich in zinc are seeds, oatmeal, and tofu, among others. Selenium is an essential micronutrient and have an impact on immune cells during activation, differentiation, and proliferation. Selenium also influences the production of cytokines and eicosanoids, which are chemical messengers that regulate immune cell function, including those involved in innate and adaptive immune responses. The richest plant sources of selenium are cereals, grains, and nuts, which can contain very high amounts. Fruits and vegetables also provide certain amounts of selenium as well. Iron is an essential micronutrient. Living cells in the immune system require iron to sustain their biochemical function, metabolism, and proliferation. Iron and immunity are closely linked because genes and proteins involved in iron homeostasis, such that cells of the innate immune system, like monocytes, macrophages, and lymphocytes, are able to combat bacterial insults by carefully controlling their iron reflux. Healthy good amount of iron comes from animal sources, and examples of which are chicken or turkey, or in plant sources such as beans and lentils, tofu, seeds, baked potatoes, cashews, and dark greeny leafy vegetables such as spinach. Calcium seems to play a central role in the activation of cells of the immune system. When the cells are stimulated, T lymphocytes, which play a central role in cell-mediated immunity, require a sustained calcium ion flow for regulation, survival, activation, and proliferation. Plenty of foods are rich in calcium. It is much better to get calcium from foods which also provide other nutrients than from calcium supplements. Electrolytes like sodium, potassium, magnesium, and calcium have both direct and indirect roles in regulating your immune system. Potassium is one of the key macronutrients present in many plant-based foods. We can get potassium from a variety of fruits, vegetables like lentils, bananas, squash, potatoes, and fish like salmon. Salt influences various immune cells. In balanced doses, sodium regulates inflammation and helps treat certain conditions through its effects on immune cells. But too much salt or sodium can promote inflammation and contribute to immune dysregulation and promote the development of cardiovascular and autoimmune diseases. Why is there a need to use the nutrition label? The food label will provide information on what you are putting into your body and how much you are eating by reading the nutrition facts. The daily values are reference amounts of nutrients to consume or not to exceed each day. The daily value for sodium is less than 2,300 milligrams per day, according to the American Heart Association. As a general guide, 5% daily value or less of sodium per serving is considered low, and 20% daily value or more of sodium per serving is considered high. So in this food label, this is considerably high because the percent daily value is 20% and the sodium content is 460 milligrams. A low sodium content per serving is ideally 140 milligrams. One of the major mechanisms of probiotic action is in determining what kinds of microbes live in our intestines. A high-fiber plant-rich diet with plenty of fruits, vegetables, whole grains, and legumes appear to support the growth and maintenance of beneficial microbes, which have been shown to stimulate immune cell activity and can be a good and adequate source to support our gut health. You need both probiotics and prebiotics because they work together to support your microbiome. They come from the non-digestible fiber in certain plant-based foods because they stimulate the growth and activity of your body's beneficial bacteria. Essential fatty acids are polyunsaturated fatty acids that cannot be synthesized in the body and must come from the diet. Essential fatty acids are structural components of every cell in the body and are converted to compounds that influence inflammation and immunity. The American Heart Association recommends eating at least 2 servings a week of fish and other food sources rich in omega-3. Sugar intake impairs the innate immune response. A data from Loma Linda University found out that the effectiveness of white blood cells decreased by up to 50% after 1 to 2 hours of ingestion and lasted up to 5 hours. Sugar intake weakens the immune response and impacts your overall health through a complex interplay of hormonal, metabolic, and immunologic process. This is just to show you how much sugar you are consuming when only 25 grams is required for women and 36 grams of sugar for men per day. This is a chart that shows our popular foods and drinks and their sugar content. As you can see, almost all have a very high sugar content. We also have good sources of sugar, and those are natural sugars which are found in whole, unprocessed foods such as the fructose in bananas or berries, and other fruits and vegetables. Natural sugars tend to be low in calories and sodium and high in water content. It has many important vitamins, minerals, and antioxidants. We have different types of fats, and I know we eat mostly the bad sources of fats because these are found in foods that we like, such as fried foods, sweets, fast foods like fries and burgers. So in the grocery, again, you always look at the food label. You will always see grams of total fat, saturated fat, and trans fat listed on the nutrition facts label. A low saturated food is defined by the Food and Drug Administration as 1 gram or less per serving, and the food must provide only less than 15% of your required calories per day. No amount of trans fat in the diet is beneficial. So like in this food label, this is definitely not healthy because saturated fat is 15% and trans fat is 3 grams. A daily 40 grams increase in fat increases the risk of diabetes by 6 times. This is because changes in fat tissues release free fatty acids and glucose into the blood and affects insulin-responsive cells and leads to reduced insulin sensitivity, thus increasing blood glucose level. We can actually get good sources of protein from plant proteins because we get good sources of amino acids, antioxidants, or phytonutrients which lack in animal protein. Replacing one daily serving of processed meat with a whole grain dish decreases the risk of diabetes by 30%. This is because processed meat has a high amount of nitrate preservatives that may increase risk for insulin resistance, thus increasing the amount of glucose level in the body. So obviously, what can weaken our immune system are our processed foods, which contain unhealthy fats, sugars, and additives. And of course, if we have reduced consumption of fruits and vegetables. So having enumerated the food and nutrients that can boost our immunity, one of the best ways to build resistance against the novel coronavirus infection and other viral attacks is to feed your body with nutrient-dense foods that can help strengthen your immune system. This is the first study done in March 2021 to report an association between dietary patterns and severity of COVID-19 illness. Healthcare workers from 6 countries with substantial exposure to COVID-19 patients completed a web-based survey. Participants provided information on demographic characteristics, dietary information, whether they are following a plant-based or pescatarian diet, or a low-carb, high-protein diet, and COVID-19 outcomes. This is just to show you that those participants who reported following plant-based diets and pescatarian diets had 73% lower odds ratio of moderate to severe COVID-19 compared to those who did not follow plant-based diets. Similarly, participants who followed either plant-based or pescatarian diets had 59% lower odds ratio of moderate to severe COVID-19 severity, respectively, compared with participants who did not follow these diets. Those who followed a carbohydrate and high-protein diet had more than 3-fold higher odds ratio of moderate to severe COVID-19. So in conclusion, individuals who reported following plant-based diets or pescatarian diets had lower odds of severe COVID-19-like illness, and individuals who reported following a carbohydrate high-protein diets had higher odds of severe COVID-19-like illness. When compared with individuals who followed plant-based diets, the results suggest that a healthy diet rich in nutrient-dense foods may be considered for protection against severe COVID-19. WHO defines physical activity as any bodily movement produced by skeletal muscles that require energy expenditure. The practice of physical activity strengthens the immune system, suggesting a benefit in the response to many chronic diseases, viral and bacterial infections, as well as non-communicable diseases. So how much physical activity do we need? We should get at least 150 minutes per week of moderate intensity aerobic activity or 75 minutes per week of vigorous aerobic activity, preferably spread throughout the week in order to attain the many benefits of exercise. For most, the benefit of exercise is weight loss and building muscle, but the benefits of exercise go beyond the surface. Studies have shown that regular exercise can improve one's immune system and overall well-being, improve muscular and cardiorespiratory fitness, improve bone and functional health. Regular exercise induces production of beta endorphins that will make you feel good. This is especially important during times of stress, which without exercise can lead to a weakened immune system. The behavior of almost all immune cell populations in the bloodstream is altered in some way during and after exercise. Exercise of various types, durations, and intensity induce recruitment to the blood of cells, expressing immunologic cell markers. Acute bouts of exercise improves immune surveillance, leading to enhanced antibacterial and antiviral immunity. This table helps differentiate the intensity of exercises. Light exercise is when you can still talk easily, just like in slow walking. Moderate exercise is when you can talk, but short conversations, just like in brisk walking and bicycle. And vigorous exercise is when it is difficult to speak, just like running. Among this, moderate intensity activities have been linked to the most health benefits. In this graph, several studies have reported that moderate regular physical activity can enhance the immune response. It has shown to increase lymphocyte proliferation and interleukin production, while intensive exercise suppressed the activity and levels of several immune cells. The possible mechanism seems to be associated with the migration of cells from endothelial tissues, as well as a phagocytic and inflammatory response to exercise-induced tissue damage. Furthermore, intense training seems to be associated with an imbalanced immunity response by an enhanced release of pro-inflammatory cytokines. There is also evidence that high-intensity exercise for a long term can lead to higher levels of inflammatory mediators and consequently may increase the risk of injury and chronic inflammation and immune system suppression. People who are physically active for about 150 minutes a week have a 33% lower risk of all-cause mortality than those who are physically inactive. Taking 10,000 steps each day has shown to benefit weight loss and overall health because you can roughly burn about 500 calories by walking this number of steps. Moderate exercise training causes favorable influence in immunity and a reduction in incidence of upper respiratory illness. The Moderate exercise training causes favorable influence in immunity and a reduction in incidence of upper respiratory illness. The anti-inflammatory influence of near daily moderate physical activity in lowering C-reactive protein, total blood leukocytes, interleukin-6, and other inflammatory cytokines may play a key role in lowering risk of a cardiovascular disease and certain types of cancer, type 2 diabetes, and dementia. So again, we should aim for 30 minutes of moderate exercise most, if not all, days. This is an analytic review of physical activity as one of the most effective ways in promoting mental and physical health and preventing diseases during the COVID-19 pandemic. The imbalance in innate and adaptive immune responses, characterized mainly by changes such as cytokine storm and lymphopenia, in addition to the disorders in coagulation and host-related conditions, including obesity, metabolic syndrome, and aging, is among the factors notoriously associated with the worst prognosis of infection, thus emphasizing the importance of investing in lifestyle habits that promote health and well-being, such as the practice of physical activity. Sleep is as important as a healthy diet and exercise. When sleep is of poor quality, it can impair our immune response because sleep and the circadian system are strong regulators of immunological process. Sleep deprivation and the accompanying stress response invoke a persistent, unspecific production of pro-inflammatory cytokines, best described as chronic low-grade inflammation, which both have detrimental effects on health. This is just to show you how much sleep do we need as we grow old. So adequate sleep is 7 to 9 hours. Sleep provides essential support to the immune system. Getting sufficient hours of high-quality sleep enables a well-balanced immune defense that contributes to a strong innate and adaptive immunity. Studies have shown that the risk of infections and chronic illnesses has been found to be higher in people who sleep less than 6 or 7 hours, and people who slept 5 to 6 hours were 4 times more likely to have a viral infection compared to those who slept 7 hours or more. Lack of sleep has been connected to multiple long-term health problems, and this is believed to be related to the negative effects of sleep deprivation on the immune system. At this time of pandemic, most of us don't get enough sleep, mostly because of anxiety and stress. If worrying about COVID-19 in our patients is stopping us from falling asleep or keeps us awake during the night, these are the things that we can do to reduce the worry and improve sleep. Number 1, we should eat healthy foods that contain melatonin, a hormone that helps regulate the sleeping and waking cycle and other micro and macronutrients that promote sleep. We should be avoiding foods and drinks that contain caffeine close to bedtime, and we should not eat anymore 2 to 3 hours before bedtime. We should exercise during the day and spend time relaxing and watching, listening, or reading things that have nothing to do with COVID-19. We should connect with others. Simply talking to someone you trust about your worries can often help because social distancing does not need to equate to social isolation. As much as possible, we should keep a normal sleep routine. We should expose ourselves to bright sunlight in the morning. Have your coffee outside, for example, or eat breakfast by a sunny window. You may take your work breaks outside in sunlight, or exercise outside, or you could walk your dog during the day instead of night. You should know how to manage fatigue. If you are tired, allow yourself to rest and sleep. Most literatures have shown that chronic psychological stress can lead to immune dysregulation. Behavioral changes under conditions of chronic stress also contribute to immune dysregulation. Short-term stress may actually help stimulate the immune system, since acute stress induces a significant mobilization of leukocytes from the blood to the skin. Brief stressors enhance quick, energy-efficient natural immunity, but long-term or chronic stress causes too much wear and tear, and the system breaks down. The most chronic stressors were associated with the most global suppression immunity. The purpose of this paper is to review, collect, and collaborate updated information and trials related to the various effects of COVID-19 on the immune system and how stress, loneliness, and lack of sleep can all weaken your immune system, making people more vulnerable to diseases such as COVID-19, wherein the stressful situation can lead to dysregulation of humoral and cellular immune responses to pathogens. Anxiety and fear are associated with, among other factors, increased inflammatory markers which may alter the function of lymphocytes and decrease NK activity. Indeed, there is a substantial body of evidence pointing at a relationship between stress and the rate of viral infection progression. This paper is directed towards identifying critical issues about decreasing the vulnerability to infection by improving our immune system and decreasing sources of stressors. It helps us realize how important having a strong immunity is. So here are some ways to relieve our stress. We should engage in activities that bring you pleasure and joy. Relaxation techniques activate a state of restfulness that counterbalances your body's fight or flight hormones. Clinical studies show that spending even a short time with an animal companion can cut anxiety levels almost in half. Go on a trip and, if possible, leave your laptops to detoxify from gadgets. Well-nourished bodies cope better, so start with a good breakfast, add more organic fruits and vegetables, avoid processed foods and sugar, and drink more water. Get enough sleep. Moving your body on a regular basis balances and increases blood circulation, helping to flush out stress hormones. Even a daily 30-minute walk makes a difference. Too busy or you're too tired? Most of us know changing to a healthy lifestyle isn't the easiest thing to do. And the sad truth is that many of us simply feel just too busy to implement any healthy changes. It's not necessarily that you don't want to have a better, healthier lifestyle. It's simply that you don't feel you have the time to make the required changes in order to turn your lifestyle around because, yes, it's not easy. It's about choice and priorities. It's deciding that your health is important enough to dedicate some time to. Most of us have an overwhelming amount of commitments and obligations. And one very unfortunate consequence of this is that being healthy is not a priority or an option. When you're rushing around, it's easier to grab a heavily processed food or go to the drive-thru rather than prepare a healthy meal. For some of us, we forget to eat completely or skip meals to save time. Always remember that healthy eating isn't a diet. It's not about eating less, like obsessively counting calories, but instead making the smarter choices and nourishing your body with real food that will keep you healthy. So how do we start a healthy lifestyle despite our busy schedules? You can make your own meals in advance, or if not, there are wellness centers who can prepare your healthy meals every day. Waking up early gives you time to eat breakfast, which is an important meal of the day. It will energize you and help you make healthier choices later in the day. You can have healthy snacks on hand. Remember, eating is about making better choices, not eating less. If you have healthy items available in your kitchen, you'll be much more likely to use them. You have to be very intentional when making more room for healthy eating with a busy lifestyle, instead of wishing and hoping you will one day have the time. Take it one step at a time. You should take things slow because it may take for a while to figure out how it will work. Don't replace all your meals overnight. Move in small but consistent steps. You may start by eating first 2 servings of fruits or veggies, then another serving the next day. Or you might want to try a meatless Monday or Saturday for a start. Gradual changes add up to big results. I'm sure we can all relate because we love to eat this all the time, most especially after a very stressful and tiring day at the hospital or clinic. We feel like rewarding ourselves with our favorite foods, just like burgers, fries. But this is just to show you that we get almost 1,500 calories from these unhealthy foods, which are almost made of saturated fats. And this is just one meal. We still have 2 or more meals in a day if we are required only 2,000 calories. Definitely, we will store the extra calories as fats inside our bodies as to compare if we eat almost the same calories, but more of the healthy foods like fruits and vegetables, and plus the fact that we can get good sources of fats, proteins, and micronutrients from this type of foods. We need to eat a wide variety of foods in the right amounts to meet your daily nutritional needs. We have what we call a healthy plate, which is an easy to understand visual guide for a healthier, balanced meal. We divide our plates into quarter half to remember the right proportions of each food group. We fill quarter plate with whole grains because whole grains are rich in nutrients because they are not overprocessed as to compare with refined grains. Another quarter plate with a good source of protein. Plant-based proteins such as tofu, nuts, beans, and legumes are good protein sources. Half of your plate should have fruits and vegetables. Fruits and vegetables are naturally low in calories, fat, and sodium, and rich in micronutrients, fiber, and minerals. Having a half plate of fruit and vegetables at each meal will meet the daily recommended intake of at least 2 servings of fruit and 2 servings of vegetables. Do you know that foods aid in our emotional chemistry? Like, for example, serotonin. This chemical is linked to well-being and happiness, and sources of this chemical is from exposure to sunlight, fruits like bananas, vegetables, and when you exercise. So be sure to eat mostly plants and vegetables because it can produce this kind of chemicals to make our bodies healthy. The purpose of this study is to assess the nutrition and exercise knowledge and personal health behaviors of physicians in the Department of Medicine in one of the academic centers. The survey instrument included questions on demographics, medical comorbidities, baseline perception of health and fitness, and knowledge of nutrition concepts. In this paper, it tells us that healthcare practitioners do not reach national standards for physical activity and healthy eating. This study again highlights the need for improvement in medical education about nutrition and physical activity. This improvement will hopefully increase physicians' focus on their own health promoting behaviors and provide physicians with tools to provide lifestyle counseling to their patients because physicians' counseling on lifestyle has a role in disease prevention and management as well as potential role in reducing morbidity, mortality, and medical costs. In these graphs, it shows that only 25% correctly identified the American Heart Association recommended number of fruits and vegetable servings per day, and just 20% were aware of the recommended daily added sugar limit for adults. 46% knew the American Heart Association physical activity recommendations, and 52% reported more than 3 hours of personal weekly exercise. Study shows that there is no trend toward improved physician personal health over time. The implementation of more widespread education of physicians on nutrition and lifestyle should be done because this has the potential effect of improving physician cognitive and emotional well-being and for physicians to focus on good, healthy behaviors. Despite our busy lives, we should take time to have adequate exposure to sunlight because one of the most important benefits of sunlight is to increase the brain's release of a hormone called serotonin. Serotonin is associated with boosting mood and helping a person feel calm and focused, which is what we need in our busy lives. Despite our busy schedules, we can actually get 10,000 steps a day. Like, for example, taking the stairs instead of an elevator, we can park a bit far so that we will have the chance to walk more steps. Instead of asking our secretaries to buy our food, we can probably buy it ourselves so that we can again walk several steps. So these are just a few tips on how we can maximize our day to get 10,000 steps, which is what I've mentioned in my previous slides is noted to be the number of steps that we could actually burn 400 to 500 calories. I've mentioned earlier that just by taking the stairs, we can actually burn calories. This is just to show you the flights of stairs we take and the calories we can burn. This is the required number of minutes spent to exercise for you to burn these calories. So in just a can of Coke, you need 23 minutes of walking, and if you eat your pizza or chips with it, you need another 60 minutes to burn the calories. So that is how much exercise you need if you have all these extra calories in your body. No matter how often experts warn us of the dangers of sleep deprivation, we continually fail to make sleep a priority, obviously because of the demands of our job as doctors. Associate Professor Stephen Howard is well known for his research on fatigue and sleep deprivation, especially as it relates to healthcare professionals. Howard's previous research has shown the benefit of napping on emergency room doctors' and nurses' performance. His research has shown that a short nap for doctors and nurses working night shifts can actually improve their mood and alertness level. The most important thing you can do is make sleep a priority in your life. Being awake for 24 hours has the same effect as being legally drunk. Among us doctors, I think we have experienced this, and that is having a burnout and having significantly affected our lives. According to the WHO, burnout is a syndrome conceptualized as a resulting from chronic workplace stress that has not been successfully managed. It is characterized by exhaustion, negative feelings about one's job, and reduced professional efficiency. During this COVID-19 pandemic, physicians have increased stress and unsafe working conditions, driving burnout rates to increase and have considered burnout to be serious enough to have a moderate effect on their lives. This paper is an analytic review regarding physician burnout as described as a multidimensional work-related syndrome. According to this report, more than 50% of physicians were reporting symptoms of burnout prior to the COVID-19 pandemic. Healthcare providers are experiencing all the adverse life impacts of COVID-19 that plague the general population, including stress, depression, grief, and isolation. There is a cultural expectation that physicians serve selflessly, caring for those in medical need and as heroes when needed. Physicians' health and personal desires typically assume secondary status. Indeed, physicians have agreed to the calling and responsibility of medicine, often at the cost of their own health. The workload increases every day, so they often lack time to process their negative feelings towards themselves and to process the sickness and death that they witness all around them. Physicians adapt to the stressors of the healthcare environment in diverse ways, which can either be positive or negative. If the stressor is overwhelming, persistent, unyielding, or otherwise unpleasant, physicians may have maladaptive responses to occupational stress, thereby putting themselves at greater risk for burnout. So again, in this paper, it is emphasized the importance of proper nutrition as a prevention for reducing burnout. Chronic stress has been shown to influence the amounts and types of foods individuals eat, contributing both to excessive eating and undereating and the development of chronic diseases. Evidence supports the application of the Mediterranean diet, cognitive behavioral theory, and mindful eating interventions. Studies have demonstrated that increased fast food consumption is related to burnout, whereas self-reported healthy eating is protective. Mindful eating is a relatively newer concept in nutrition and a potential strategy for overcoming negative consequences of burnout on nutritional status. Mindful eating is most consistently described as making conscious food choices, developing a keen awareness of hunger and fullness, and noting physical and emotional responses to eating. Mindful eating interventions have been mostly frequently and effectively applied to individuals who report emotional eating or binge eating behaviors. Although evidence for dietary interventions to overcome burnout is limited, but still it is promising. While traditional medications and therapies are well needed to beat stress during the time of pandemic, one of those ways is again through our nutrition and dietary habits. In this paper, a research by Opie et al. In 2015 demonstrates that our dietary choices are more important. This paper mentioned foods that amplify anxiety and foods that help tamp it down, like for example, caffeine. It is important to realize that excess caffeine in your diet can precipitate or worsen anxiety. Most studies show that less than 100 milligrams of caffeine has little or no effect on anxiety, but if it is above 400 milligrams a day, majority of studies show a significant increase in anxiety. To put this in context, one Starbucks venti of 20 ounces puts you over the daily limit of 475 milligrams by itself. So it is important to adjust amount of intake based on concentration of caffeine. Just as there are foods that amplify anxiety, there are also foods that help tamp it down. Diet rich in dietary fiber may reduce the risk of depression, anxiety, and stress. The effect of omega-3 polyunsaturated fatty acids on anxiety and inflammation has been also studied in a number of randomized controlled trials. Dietary choices can have an impact on one's response to the current stressors. This literature supports a reciprocal link between positive emotions and healthy lifestyles. For example, physical activity improves mood and increases positive emotions. Individuals who consume more than 7 servings of fruits and vegetables a day report feeling calmer, happier, and more energetic. Individuals with low amounts of sleep of 4 to 5 hours of sleep report greater stress, anger, and sadness. Physicians with regular mindfulness practice and enjoy reduced stress, physical illness, depression, anxiety, and burnout. This physician also experienced improved and perceived empathy by their patients, patient adherence to recommendations, reduced medical errors, and better patient outcomes. Along with healthy lifestyle, positive psychology interventions can boost subjective and psychological well-being. Intensive individual interventions offer the greatest potential to improve physicians' physical, mental, and emotional health and combat burnout. Certain hormones are known to help promote positive feelings, including happiness and pleasure. These happy hormones include dopamine, which is a feel-good hormone associated with pleasurable sensations, like when you complete a task. You do self-care activities, eat a good healthy food, and you just choose to be grateful and celebrate the little wins in your life. Serotonin helps regulate your mood as well as your sleep, appetite, digestion, and memory. Oxytocin is a love hormone which can help promote trust, empathy, and bonding in relationships. It also increases with physical affection like kissing, cuddling, so you can play with your pets, hug and kiss your children, your husbands, or your wives, or go out with friends and just simply say something good to others. Endorphins are your body's natural pain reliever, which your body produces in response to stress or discomfort. It tends to increase when you engage in reward producing activities such as eating and working out. So, in summary, we strengthen and optimize an effective immune response if we eat healthy and we are physically active, if we are mindful of our stress and we do something about it, if we have quality sleep, we don't have any vices like smoking or alcohol, and lastly, if we connect to others. A truly healthy immune system depends on a balanced, healthy diet, regular exercise, and good sleep, and overcoming stress over time. It's like training for a battle and preparing your body ahead of time so it can throw a good punch when attacked by viruses, bacteria, and toxins, which at this time, a strong immune system is our only primary defense. And for all of you, how do you define a good life? So to us, we may define this differently. Some may define it as having all the money, power. Some may define it as being successful. But for me, a good life means finding the purpose and meaning in your life. A life of happiness, joy, and good health. A life where you are in good relations with your family, friends, and co-employees. A life where you are able to do the things that makes you happy and contented because you are healthy and strong. A life where you are hopeful, grateful, and faithful to God. Sometimes we doctors think of ourselves as superhumans, that we can get sick, that we are not allowed to rest, that we don't have a choice but to be strong because so many depend on us. But we are humans too, that we also get scared, tired, frustrated, and that it's okay to take a break, to go ahead and cry, to stop and take a rest for a while, that it's healthy to admit that you're not okay. But don't let it win. Do something about it and be happy for yourself because we deserve it. Living a healthier lifestyle isn't just all about losing weight, exercising more, and eating better foods. It's all about you as a whole. Let's learn to love ourselves a little more. Make yourself a priority, and let us stop saying that we don't have time, but rather, let us make time to better ourselves by starting a healthy lifestyle. Changing into a healthy lifestyle definitely have its challenges. At first, it will always be difficult, but we need to strengthen ourselves with good nutrition, exercise, sleep, overcoming our stress, and maintaining a good connection with others so that we will be able to continue our calling as doctors, and that is to serve, heal, and preserve lives. But now, with a strong body, a healthy mind, and a peaceful heart. So choose to be healthy and start now because nothing seems impossible until it is done. Thank you for your kind attention. Stay safe and welcome to your healthy lifestyle. God bless us all. Okay na,
Stop ko na,
Mars?
Doc, ha? Very good. Stop ko na, Doc, ang live
Oh,
stream.
wait na mo. Diyos ko.